Thank you very much, Amy. Hello, everybody. Great to be here. My name is Tony McAleavy. I'm the Research Director at Education Development Trust. And as Amy said, I'm going to say a little bit about the extended learning team concept that we've been developing with community health volunteers in Kenya. So next slide, please. Let me explain a little about who we are. Education Development Trust, it's an international not-for-profit organization. We work to improve education outcomes around the world. We've been in existence since the 1960s, and we used to be called, slightly confusingly, CFBT Education Trust. We changed our name a few years ago, Education Development Trust. Headquartered in the UK, but working all over the world. Essentially, we do two or three things. We work with governments to design and deliver school improvement interventions, scale. We provide consultancy on different facets of the reform of school systems, and we undertake educational research with a particular focus on the identification of promising practice in school reform. And almost all of our research is freely available via our website, and please do check it out. And recently we've been doing a lot of work looking at promising policy responses to the COVID pandemic. A couple of concrete examples about what we do. We've got a substantial portfolio of work in sub-Saharan Africa. I'm going to talk about our Girls' Education Challenge work in Kenya, but we're also working on national reform programs in other African countries, in Rwanda, in Ethiopia. In MENA, in Jordan, we're working with the ministry and the UNICEF on something called a Learning Bridges project, supporting schools to maintain learning continuity for 1 million students during the COVID emergency. We work in low-income, middle-income, high-income contexts. In England, we work closely with the Department for Education. And we're involved at the moment, for example, in a national program to provide training for early career teachers. Within the context of a new research-based framework relating to early career professionalism. And I think there are some learning team elements in many of these interventions. So our work in England is based on a recognition of the need for training based on clarity about role specificity within the school team. In Rwanda, we're developing a new role, the consultant head teacher who works across a cluster of schools, still working as a head teacher back at base, but also working across a family of schools, promoting the professional learning of peer head teachers. And we're really delighted, by the way, these consultant head teachers have been able to mobilize their peers as part of the recent Back to School campaign. So next slide, please. With funding from the UK government, we work with the Ministry of Education in Kenya, supporting the learning engagement marginalized girls in some of the country's most disadvantaged communities, urban slums in Nairobi and Mombasa, and the so-called ASALs, the arid and semi-arid lands, which are remote rural areas. And today I'm going to talk about our COVID response, but the approach that I'm going to describe predates the crisis. It goes back to a project that started in 2013. And before the crisis, we had really promising impact data relating to the way the approach was engaging girls and the outcomes as measured, not just in terms of school enrollment and completion, but also in terms of literacy and numeracy skills. Next slide, please. We endorse the key messages of the Education Commission report on the transformation of the education workforce. And we like a lot the concept of the learning team. And as you will know, the report sent out, and Amy's referred to this, a series of visions, really. And the ultimate vision is one where there are networks of schools whose work is underpinned by a strong cross-sectoral partnership. And today I'd like to highlight an example of what such strong cross-sectoral partnerships might look like, with reference to our work in Kenya, where education and health specialists work together. Next slide, please. Our approach formalizes a partnership between school professionals and a cadre of Kenyan health workers known as community health volunteers, CHVs. The term volunteer is a slight misnomer, as many of them are actually paid a small stipend. Now, the CHVs were an existing resource. They've been part of the Kenyan health system since the 1970s. And the main duties from the beginning of the CHVs were to visit homes to determine the health situation at household level, to promote key health messages, and to work with community leaders on key health interventions. Now, our 2013 project sought to establish a new synergy between schools and CHVs as part of our attempt to reach out to marginalized girls, their families, and communities. Next slide, please. And since 2013, we've been able to redefine the responsibilities of the CHVs, combining health and education accountabilities, and more formally connecting their work to that of the education system. So they're responsible for identifying vulnerable children at household level, providing families with advice on healthy living practices, referrals to health services, tracking girls, individual girls who've missed school, and encouraging attendance. And the result has been that overall, the CHVs, they've become a key source of data for the education system, as well as the health system, able to often take proactive steps at household and community level to encourage engagement with schools. Next slide, please. The value of the work of the CHVs has been highlighted over the past year. During the recent prolonged period of school closure, the CHVs worked closely with education professionals to encourage home learning. They encouraged girls to listen to radio broadcasts and acted as intermediaries for the distribution and collection of hard copy learning materials and assignments. This diagram illustrates how the system worked. High-tech solutions were impractical in this highly disadvantaged context. Instead, the solution combined low-tech, no-tech components. Low-tech in the form of the radio broadcasts, and no-tech through the use of workbooks, which were distributed by the CHVs and collected for marking by them. Next slide, please. I think clarity of expectations is important for different members of the learning team. During the period of school closure, we formally redefined additional responsibilities, incentivizing with modest cash payments these additional responsibilities, which included the following: monitoring the participation of individual girls in distance learning, promoting the idea of the benefits of learning continuity with parents and community leaders, delivering the learning packs for home learning, and enabling the educational professionals at a distance to mark and return work undertaken at home. Next slide, please. The impact data has been very encouraging, and we believe that the community health volunteers have made a substantial contribution to the management of the school closure crisis. Our researchers undertook a household survey in order to measure learning engagement during school closure. Parents and caregivers were asked to estimate how much time their girl children spent each day on schoolwork, despite the closure of the schools. Households responding to our survey indicated that 90% of girls in the arid and semi-arid lands were spending more than 2 hours a day on learning, and 79% of girls in urban areas were achieving this level of learning continuity. And these levels of continued engagement compare well, for example, with rates of learning engagement of disadvantaged students in the UK during school closure. The difference between the rural and urban areas is instructive. It's probably a variety of factors, including a greater degree of community cohesion and solidarity in the rural areas. So there are still problems, and some of the girls not engaged. But despite these problems and limitations, we consider that the cross-sectoral learning team approach proved to be one of the most useful and one of the most resilient features of the education system during the period of school closure. Next slide, please. So that's me finished. If you'd like to know more about our evaluation of the role of the CHVs or anything else, please check out our website. And also the report, the evaluation is there in its own right. So here are the key addresses, and thank you very much for your time. Thank you.